Hello, my name is JC and welcome to our presentation on student-driven remote hypertension monitoring program. The objective of this program was to develop and implement a student-driven remote hypertension program during the COVID-19 pandemic. The program was developed as part of a collaboration between Wilkes University Nesbitt School of Pharmacy and two Pennsylvania Pharmacist Care Network pharmacies. The research team consisted of 4 pharmacy students who were mentored by 2 faculty members of Wilkes University. The faculty mentors recruited a combined number of 18 participants from their practice sites to partake in this newly developed program. All patients were provided a blood pressure wrist cuff monitor and a handout, which can be found in the QR code on the poster. We felt as though this opportunity was beneficial to us due to the gain of direct patient care experience while offering education on a chronic disease during a time when patients were less likely to seek primary and emergency care.
Hi, my name is Stephanie, and next I would like to discuss our program design and the interventions that we made. The program began in June, where we performed literature searches and met with our faculty mentors weekly to create topics based upon evidence-based information. We then spent the next 2 months creating our curriculum and patient-friendly handouts. Our curriculum topics, which were developed to educate on common factors that impact blood pressure, can be seen on the left-hand side of the poster. These were loosely formulated into scripts to allow for a consistent delivery to all patients in the program. The patients were divided equally amongst us students to perform the calls, which we began in August. A majority of the weekly calls were performed telephonically, and a few calls were performed over video conferencing. During each encounter, we began with a topic overview, then we would have a blood pressure reading and a SMART goal discussion, which was based upon the readings collected and the goals set the previous week. Following this, we would then discuss the predetermined hypertension topic, followed by the opportunity for the patients to ask questions. We would then conclude the call by having the patient set a new SMART goal and then recap with an overall call summary. During the calls, 2 student pharmacists were present. One student delivered the content and the other student documented the encounter in an e-care plan template. In calls where clinical knowledge was being presented, a pharmacist preceptor was also present. The program concluded in October for us. The 3 main interventions made throughout this remote hypertension monitoring program were blood pressure monitoring, hypertension education, and goal setting. Patients responded well to these interventions, as demonstrated by their request to begin more frequent blood pressure monitoring and to create more mini goals each week.
Hi, my name is Marianne, and I will be covering evaluation and going over different patient and student perspectives. Patients stated that lifestyle changes, such as diet and exercise, were carried out throughout the program and were continued even after it concluded. Some patients also mentioned that they particularly enjoyed the program because it was student-driven. The program allowed patients to become more knowledgeable about high blood pressure or help reinforce prior knowledge. We as students also enjoyed the fact that the program was student-driven. We felt more confident when delivering education about high blood pressure to our patients. We loved talking to our patients every week and being able to establish a close relationship with them. Here are 2 quotes from a patient and a student to help better explain what they liked about the program.
Hi, my name's Emily, and in conclusion, the program was found to be an overall positive experience from both our and the patient's perspectives. Allowing us to deliver this remote educational service not only enhanced our professional growth, but also impacted the patient's engagement in and participation in their own health. Through this program, we were able to bridge the gap between health literacy and disease state patient education in the community. Both participating pharmacies plan on continuing this program, as well as utilizing a similar model for developing future programs and expanding upon topics to educate on. Examples of curricula are diabetes, hyperlipidemia, and mental health. Further studies should investigate the impact of a student-led hypertension education program on patient blood pressure control and support community pharmacy outreach efforts. If you scan the QR code with your phone, located above the conclusion section, it will take you to our references and other resources that were utilized. Thank you.